Welcome to the Doggy Dojo. I'm your host, Susan Light, a Los Angeles-based dog trainer on a quest to become worthy of the title Sensei of the Doggy Dojo. Today, I want to talk about what it's like to work with a veterinary behaviorist. Not every person will need to work with one, but if you need one, they can be life-changing for you and your pet. We're going to explain what the title means, when to call one in, how to find one, and what to expect working with one. My guest is a DrMedVet who completed a doctorate thesis in animal behavior and is currently a third-year resident in Veterinary Behavior Medicine through both the European and American colleges of Veterinary Behavior Medicine. She opened her own small animal clinic, the German Veterinary Clinic, in Abu Dhabi in 2008. The clinic has grown from herself and two nurses to a team of over 28. It's the first ISFM gold standard cat-friendly clinic in the Middle East, and her team was the first to become fear-free certified in the Middle East. She has a regular spot on the Dubai Eye radio station as a guest speaker for all things pets and has had numerous articles published. Please welcome Dr. Katrin Jahn. Welcome to the podcast.
Thank you very much. Lovely to be here.
I'm super excited. There's a lot of cases when I'm always recommending bringing in a behavior professional. Do you mind explaining a little bit of an overview for people that maybe are not familiar, the difference between the different titles that might be on a team helping an animal through a behavior issue? So like a trainer, a behavior consultant, what's a behaviorist, what's a regular vet, what's a vet behaviorist?
Yeah, that's a great question. And sometimes it gets quite confusing. And I think one of the things that is sort of a really big topic, especially in the behavior field, is that it's not necessarily regulated. So somebody can call themselves a behavior consultant or a behaviorist even, if they've only done sort of a weekend course in something and have gotten, a piece of paper or a document. So I think it's always really important for people to kind of do their research. But to answer your question, so a trainer usually would work mainly with learning theory. So, hopefully only the positive reinforcement quadrant of the 4 quadrants that we have in operant conditioning, as well as classical conditioning and desensitization, those types of things. So that's kind of the realm, I guess, of a trainer. And that's really to teach mainly, I guess, operant behaviors first and foremost. A behaviorist or a behavior consultant would perhaps work more with problem behaviors. So where people are experiencing a problem that they would like to have addressed, and they might look at it from perhaps the animal's emotional point of view through that sort of emotion lens. So I guess that's where a behaviorist or a behavior consultant comes in. And then a veterinarian takes care mainly, I guess, of your pet's physical health. And a veterinary behaviorist really looks at both the physical and the mental and emotional health of the pets. So a veterinary behaviorist has had exactly the same training as a vet, so has gone to vet school for a number of years, and has then decided to specialize in behavior. So that usually means doing an internship and then a residency, which is what I'm doing now, in order to specialize in that field. And that's then when you get your veterinary behaviorist. So a veterinary behaviorist really should be board certified. Otherwise, they shouldn't have the ist on the end of their name. And that is regulated, I think, in most places. That's correct. Maybe the only title here that does have a requirement. Yeah, that's correct. And I think most veterinary behaviorists are also quite protective of that title, because
they should be.
Exactly. Yeah. So much work has gone into that. So you can't really call yourself a behaviorist unless you're boarded. You could call yourself a vet with special interest in behavior, or you can have in the US vets with practice restricted solely to behavior. So they do nothing else but behavior. But that doesn't mean that they've gone through a residency and they've become board certified.
Yeah, I went through this when I spoke to the board certified canine dentist, veterinary dentist. That was he's like, there's no such thing as a certified canine dentist, a veterinary dentist. But, there's fewer than 200 board certified veterinary dentists. He's like, that doesn't mean that there aren't veterinarians that just decide to only do dentistry and basically, you know what I mean? But they just haven't gone through all the schooling, paperwork and whatever. So I think it's great to sort of, and you have a great perspective on it. If you're just talking about a vet who's doesn't have a special interest in behavior, how much experience with behavior do they have?
Yeah, so not a lot. And that's a little bit where I think the gap comes in, or where, we see a bit of a divide. So in most colleges, certainly I think in the US, in Europe as well, in the UK, I know for sure, vets don't get a lot of training in behavior at vet school. So they come out of vet school not knowing a lot about behavior, let alone things like psychopharmaceuticals or learning theory, or, the sort of the physiological aspects, I guess, of behavior. That's something that most veterinarians wouldn't know that much about. I think it's getting better. And certainly we're starting to tackle that more at vet school level. We're actually starting to teach vet students more about that.
Oh, fantastic.
Yeah, which is great. And that's very much needed. But I do know that many of my colleagues don't feel comfortable, don't have the time perhaps, and don't maybe have sort of the understanding of how to put it all together with the physical side when it comes to behavior.
Yeah, because I think that's something that's important for people to understand, that we ask so much of vets. So I don't want to sound like I'm at all looking down on a quote unquote just a vet, because to understand what that is, they have to know so much about a ton of species, right? So I feel like they ask them to know a little bit about a very broad spectrum, which makes it difficult if they don't then in practice specialize and sort of hone in and learn more and more and more. It's just, they can't exhaustively cover absolutely everything that will come up with every species in veterinary school. It's impossible.
Yeah, absolutely. And, both in every species. So yeah, we do, exotics and farm animals and equine and small animals. And there's a difference between dogs and cats, as we well know. Mm-hmm. So there is all that sort of species divide, but then also all of the different areas. So if you think about ophthalmology, dermatology, cardiology, neurology, emergency medicine, general practice work, there are so many different sectors within even just one species, that it starts to become really difficult to know many things very well. And you're right. I think, yes, there are such great demands placed on vets, and it's impossible to meet all those demands sometimes.
It's kind of crazy. Like, the more that I've learned about it, it's a little bit mind blowing what we ask of them.
Yeah.
It's crazy. But thank you to all the vets. We really appreciate you going through that. So be nice to your vet and your veterinary staff, okay? Because
yes, please.
Honestly,
please do.
Everybody needs a little kindness, and they're going through a rough patch right now for sure. But so that makes a lot of sense. Thank you so much. So now we know what a vet behaviorist is. Do you have guidelines or sort of a mental checklist for when you should get one involved? Like, are there things that you think immediately, okay, you need to have a vet behaviorist involved? Or is it more of like a ladder where it's like, let's try this first. Let's start with a trainer. Okay, then let's bring it up to a behavior consultant. How do you tell people to approach that?
So I actually think it should be the other way around. So the vet, maybe not the veterinary behaviorist, but certainly perhaps the vet with an interest in behavior, or a vet in general, should really be the first port of call, because we know that there are so many physiological diseases and presentations that contribute to behavior. So if we think about pain, if we think about endocrinology, so let's say a diabetic cat, that's perhaps urinating more, and then that also all of a sudden starts urinating outside of the litter box. Well, if you went to a trainer or a behavior consultant first, you might miss that really important aspect, which is actually the cat is, producing so much more urine because it's diabetic. That's why it's urinating outside of the litter box.
Yeah.
And sometimes I think people can spend a lot of time and a lot of money, perhaps going down other avenues first. And then they get very sort of frustrated and despondent when things don't work. And they might not work because the animal has a physiologic underlying problem that needs to be addressed first.
Amen.
So Yeah, I always say your vet or your vet behaviorist or your vet with a special interest in behavior should be your first port of call, and they should then get involved, the trainers and the behavior consultants that can perhaps do the more sort of day-to-day hand-holding of the clients through specific things, or the vet behaviorist sets the treatment plan and then brings in all these other wonderful specialists, whether that's a fantastic trainer or a physiotherapist, a rehab specialist to work on pain issues, for example. So there's could be a whole host of other professionals that then come on board, and that makes more sense to me because I've seen so many clients frustrated, and they'll say in their questionnaires to me, you're our last resort, you're our last hope.
Yeah.
And when I read that, my heart just sinks because I think, oh, yeah, because by the time now that they've gotten to me, they've spent so much money, they've spent so much energy, they're so probably despondent and frustrated, and the animal hasn't received the help that perhaps it's needed. So I would encourage people to try and think the other way around. Think of a vet or a vet behaviorist first, and then, let us bring in all the other amazing specialists in their field, the trainers and the rehab people to support, that sort of treatment plan.
Yeah. And I do want to point out, so any ethical Lima-based trainer, and I have my issues with Lima because, of course, it ends with positive punishment, and I wish they would change that. But, the first thing you want to do is address the physical, needs of the pet, and that includes a health check. So any good trainer that you're coming to with a behavior issue will say, have you gone to the vet? Right? Yeah. We'll send you to your vet first. But I really want to point out to people that, just like we said, vets have like a million things going on. They're also not mind readers. So when we say, have you gone to the vet? This is not, oh yeah, I just had them in for their rabies shot and they didn't say anything.
Yeah.
I just had them in for their yearly and they didn't say anything. You need to make that appointment and tell the vet the behavior that's concerning you so they know what tests to run and what to look for, because the cat can't talk to them. The dog cannot talk to them. And behavior has a function. So you need to be giving the vet that information about specifically the behavior, and then they can run those tests, and then you could, tell the next professional, yeah, they said there's no, they ruled out this and that, and they said there's not a medical issue. That's what we're looking for. Because like you said, it's a medical issue a lot of times because behavior has a function.
Yeah.
It's not coming out of nowhere.
Yeah. And just as a little tip there, so vets love data. So if you can go to your vet and let them know that the behavior that's concerning you, if you can give them something like, my dog is defecating 6 times a day, your vet will know that that's not normal and that is a behavior that you're concerned with, and, that they should also be concerned with. Or, something like, my dog used to always be able to jump into the car. He now can no longer jump into the car.
That's a great one.
Right. My cat.
Or doesn't want to sit.
Yes.
That's the one I see a lot.
Yeah. Doesn't want to sit, or sits awkwardly, or then kind of struggles a little bit to get back up again. Yeah. Or, the cat who no longer accesses the favorite hiding spot, up on a cat tree or something like that. So I think the more specific you can be and the more data driven your information to your vet can be, the better your vet is going to be able to understand and, decide the appropriate action depending on what you've told them.
Yeah. So are there any things that you think, you're definitely going to need to see a vet behaviorist specifically, like severity of an issue, or like, are there any guidelines where it's just like jump straight to the vet behaviorist, even over the regular vet?
Yeah, absolutely. I think, some of the sort of, classic behavior presentations, such as separation distress or, separation anxiety. I know it's not always anxiety, but that sort of panic when left alone, true sort of fear, anxiety type behaviors and aggressive behaviors as well. I think they are definitely behaviors that would benefit seeing a veterinary behaviorist and compulsive behaviors, because even if we do find something physiological there, even if, let's say, we have a noise phobic dog that has pain, we probably still need to address the noise phobia via a vet behaviorist. Okay. So I think some of your classical presentations. The other thing is, if somebody's been working with a trainer for a long, long time and they're just not making any progress, they've either, hit that glass ceiling, or they've hit a brick wall, we often call it, and, they're doing all the right things, and, they're doing, good positive reinforcement based training. However, it's not helping the issue, the dog or the cat is still showing the emotional side, I guess, of the behavioral context. Then that would be another time, I think, to go straight to a veterinary behaviorist. And anywhere where there's potentially a crossover between something physiological and a learning from that physiological thing. So let's say we've got a compulsive behavior that maybe started as something physiological. So let's say you've got a cat with fleas that starts over grooming, and then learns that the grooming behavior actually makes them feel better and gives them some kind of internal relief. And then we treat the fleas and that's all gone, but the cat may still perform the behavior because it's learned that behavior is highly motivating and highly functional, as you said. And you need to then address, that learning. How can we then break down that learned behavior? And how can we make sure, or how can we sort of disassociate the physiological from the learned behavior?
We're going to take a quick break, but you can find Katrin and access the many free resources she provides online at www.trinityvetbehavior.com, Instagram at Trinity Vet Behavior, or Facebook. Just search Trinity Veterinary Behavior. She also has a Facebook group called the Pet Behavior Community, and I've linked them all in the show notes for you. We'll be right back. Do you have any advice on how people can get in to see one in a timely manner? I don't know about in Europe where you're mostly working, but in the States, the only vet behaviorist I like to refer, her wait list is crazy.
Yeah.
And months and months. Yeah,
I know. And it's a big problem. And that's solely because there just aren't enough of us around at the moment. I think you mentioned about the veterinary dentists, having sort of 200 boarded members. With veterinary behaviorists, it's even less. So I think in
Really? I would have thought it would be more.
No. So I think in the US, we're looking at about maybe 100, 130.
Holy smokes. No wonder.
Yeah. And in Europe, even less. You're going to be shocked at this number. So in Europe, we probably only have about 30 to 40 boarded.
Oh my God.
I know. So that's the biggest.
Wow. Okay.
Yeah.
Wow.
That's the biggest problem. What I do think is happening a lot now, I think, through sort of the last couple of years, many of us, and in the US, I think it depends a little bit which state you're in, but many of us are able to offer virtual consultations, or we're able to offer vet-to-vet consultations, which are much shorter. So where we offer case support and case advice to general practice veterinarians that might have a behavior case that walks into their practice and they're not quite sure how to approach it, or perhaps what medication to use. So those are good options. I know that quite a few veterinary behaviorists are using that. So it might be worth mentioning to your GP vet, can you have a look and see if you can find a veterinary behaviorist that offers vet-to-vet consults? Mm. And then I know that many veterinary behaviorists are making available more and more resources on their websites. So on my website, for example, I have a whole page that's dedicated just to free resources, which are mainly PDF sheets that explain a little bit more about certain things. There are a few sort of tracking and logging charts on there. There's something about toilet training, which I know is quite basic, but it comes up time and time again. Mm-hmm. So I think, there are more sort of digital resources available. But yeah, of course, in many instances, you need to see a veterinary behaviorist or a vet who is interested in behavior. And so that number that I mentioned, sort of the 100, 130, those are the boarded veterinary behaviorists. Now, there are probably another 100 or 130 of us residents, and depending on which year we're in. So a residency usually lasts for 3 years, but with behavior, sometimes the residencies go a little bit longer just because there's such a huge amount to cover. So I'm in my 3rd year. I've seen almost 350 cases, which gives me a really good sort of case experience. And most of us residents will have that number of cases under our belts, there or thereabouts. So, asking for residents, and often we'll be working with the boarded veterinary behaviorists. They'll be our mentors, so asking them, hey, if you're not available, have you got a resident that's maybe available and seeing cases?
Great idea.
That's another good way. Yeah.
Okay. Fantastic. So let's say that you're on a wait list to see or you have your appointment, but it's several months down the road. Mm-hmm. What should the pet parent do in the meantime? I mean, they can avail themselves to your free resources or possibly other free resources. Do be careful where you're getting information on the internet, though, people. Yeah. So, I love that you are an amazing source. So if you're offering free resources, I'm definitely going to put all of your links in the show notes so people can find you. But do you have any other advice what they should do in the meantime? Should they start working with a trainer? Because I've worked with a couple of cases that, I'm like, you definitely need a behaviorist. They're like, yeah, my appointment's in 6 months.
Yeah.
Do you think that that's worthwhile working in the meantime on anything?
Yeah, so I think definitely what can be done in the meantime is what we refer to as behavioral first aid. And sometimes you can even ask for a first aid appointment, which is really where, a behaviorist might give you a shorter appointment, maybe just a half hour or an hour appointment, where they go through with you the real sort of first aid things, which is often to do with safety management. A lot of times, we'll tell you, stop doing things, stop exposure to triggers, just to try and get that animal's brain to start settling down and to prevent those neurological pathways strengthening through practicing unwanted behaviors. So some of those first aid strategies I think would be really useful. And I think that's where a really good trainer can also come in. So if you as a trainer have a really good relationship, perhaps with a vet or a vet behaviorist, then, speak to them and see what might be those first aid strategies that you can already start coaching the client in. And then in the meantime, also get a full physical exam done, have a look at, I always say pain, so musculoskeletal, gastrointestinal, skin, and sometimes neurological. Those would be sort of definitely the first places to look. Find out, is the dog having diarrhea, loose stools, vomiting regularly? Are they itchy? Often those things are so closely related to anxiety, fear, but it's really good to get those things already checked out and perhaps ruled in or out before seeing the veterinary behaviorist.
Yeah, I know that the data is not good, but I've heard some studies pointing to upwards of 80% of behavior cases presenting some kind of pain.
Yeah.
So, I mean, I don't believe that that's like a huge study that came from, but it's mind blowing.
Yeah.
That, and it makes sense. We're all in pain at a certain point in time. So our pets might as well. Would you ever recommend possibly through the vet, clearly not just self-medicating your animal, going through possibly a pain trial or trying, I know vets can't recommend CBD here. Would you try any pain mitigation things through your vet first?
Yeah, so a pain trial is not a bad idea, especially if the vet perhaps suspects. So pain is difficult to diagnose because, the pet doesn't have to be limping or yelping in order to be in pain. And chronic pain can be quite difficult to detect. So a pain trial, absolutely. I wouldn't be recommending CBD at this point in time, just because we haven't got enough data. I always say CBD could be the next best thing. We don't know, but we just don't have enough data to verify that. And the study that you mentioned just then about the 80% of dogs in pain. So it's not a huge study, but it's an extremely good study. So it's actually a multi-center study that comes from a number of veterinary behaviorists. It was actually, the study was called to life at our Washington conference in 2019, where Daniel Mills, who's a famous veterinary behaviorist here in the UK, actually asked the room, hey, who's seeing pain, as a sort of a chief presenting complaint? And almost the whole room put their hands up. And so it was a collaboration of many veterinary behaviorists and the cases that they saw. So it's a good study. And actually just recently, I think last month, another really good study came out looking at the link between atopic dermatitis, so allergic skin disease, and fear, anxiety, and aggressive behaviors. So I think there's more and more coming out, just demonstrating that very strong sort of link to physiology. So absolutely, a pain trial or, a trial with an anti-allergy medication, perhaps if the dog is itchy. So, all those things can be done in the run up to or whilst people are waiting for their appointments with the veterinary behaviorist.
Oh, so much good information. Thank you. So we're almost out of time, but I don't know if we can address, again, so let's say you've got your appointment on the books. What should people expect when they work with a veterinary behaviorist, and how can they best prepare for the initial visit? I mean, you already mentioned data, gathering data, trying to rule as many things out with your regular vet or getting all those tests done. Anything else that you recommend? And just a little bit about the expectation, because like you said, it's probably not going to be the vet behaviorist. You guys are so limited and so busy walking you through the treatment step by step. It's going to be, how does it usually work?
Yeah, that's a great question. So every veterinary behaviorist is going to send you a questionnaire, and those questionnaires are usually quite lengthy. So fill the questionnaire in as much detail as you can, because it's going to really help us to prepare for your appointment as well as we can. Sending in videos. Now, never ever send a video of, or never create a situation.
Yes, to get it on video.
Exactly, just to get the video. Yep. But even things like, everyday interactions, how is your dog with other dogs that might be in the household? How is the dog with people? How are they around strangers or visitors coming into the home? Really good to get videos of them walking up and down stairs, and, perhaps jumping into the car, just so that we can already see a little bit that sort of mobility, if there are potentially any pain issues or mobility issues. So preparation is the first thing. The consultation itself usually lasts for around 2 hours, depending on who you see. One of my mentors, her consultations are 3 hours. Wow. I tend to find between an hour and a half and 2 hours is usually the limit of what most people can actually take in, and how well the dogs cope if they're coming into the clinic, if it's not a virtual consult. And then what should happen is really sort of a discussion of the history of specific events, really kind of going through the behavioral issues in detail. And then at the end of the consultation, you should come away with a diagnosis or diagnoses. There are usually more than one, and a treatment plan. And the treatment plan is going to be multifactorial. It's going to be tailored to the individual patient, and it may include those other specialists. So it may include a behavior modification piece, which is where the trainer comes in, or it may include, seeing a pain specialist or a rehab or a physiotherapist. And it may also include behavior medications, psychopharmaceuticals, or diets, pheromones, supplements. And it's going to include a lot of management. So how are you actually going to manage this animal going forwards? And sometimes we also need to have the challenging conversations, right? Are we going to go forward with this pet or not?
Wow.
Yeah. So those things come in there as well. So they're extremely comprehensive. And I think it's really important for us to have those difficult conversations, because, it affects everyone's quality of life, the animal, the people. And we want to make sure that we can improve that quality of life and that welfare as best as we can. And not to put a downer on it, I would say, 99% of my patients go away with a treatment plan, and we see, really great outcomes, but there will be the odd case that may not have such a nice outcome.
And how much follow-up do you usually end up doing with a vet behaviorist? Is this something where you're checking back in every 6 months or a year, or you go out with this very comprehensive plan and working with the other professionals, and then is that sort of how far it goes with them?
Oh, no, we do very frequent follow-ups. So once you're in, you're in. Certainly with me. Certainly with me. You know, once I've seen you, and especially if I have you on psychopharmaceutical medication, I want to know. So if a patient of mine does go away with medication, I check in with them every 24 to 48 hours in the first 2 weeks, because I want to know how things are going, if there are any problems, if they're experiencing side effects, if there's something that we need to change. I want to know how the management strategies are going, whether they're even achievable for the clients. You know, if we need to tweak something, I get my clients and patients to send in weekly diaries. So they'll send in a weekly diary to me. You know, I'll give them certain behaviors perhaps to count or track to see whether we're making progress. And then I'll do a proper follow-up appointment, usually about 6 weeks after the initial consultation. And that's usually 45 minutes to an hour. And that's when we might adjust medication doses or then go sort of to the next phase of the treatment, if you like. So like I said, I think once you're on the books, you get pretty good support.
Which is probably why it's even harder to get the new people in.
Right.
Because, you know, it makes total sense. I just want to point one thing out. We're totally out of time, but I want to point one thing out, and I can't resist asking one more question. We'll see if it makes it in the cut. But I just want to point out that you, a very educated, going through your residency, PhD in behavior, thesis in behavior. Yep. I don't know if I'm saying that correctly, but you are recommending only positive reinforcement and then, you know, possibly medical interventions. You're not going up that, as we said, Lima scale and saying, oh, you know what, we're going to save this dog by throwing a shock collar on them, which is the things that quote unquote balance trainers would have you believe they're doing, that they're quote unquote saving dogs by shocking them. So I just want to point that out. I've pointed out to many people that the more education you have, the far less likely you are to use aversive training methods. And there must be a reason for that.
Absolutely. I mean, if you're thinking about that Lima scale, we hardly ever have to get past the first, you know, 1 or 2 stops on that scale. So it's really about the physiology and then the management, and their positive reinforcement. And that's as far as it goes. There's absolutely no need for any kind of aversives, let alone shock collars. I get so many people that say to me, you know, shock collars are so great for the dogs that have high predatory drive, you know, that chase and then get shot because they're chasing. And I just find that I find that so difficult to sort of get my head around, because surely you would manage the situation. You would use that point right on the bottom of the scale, which is about management, where you don't put that dog into that position. I know life isn't always perfect, and I do know that, you know, things happen. But I'm sure that there are other ways around that, you know, a really strong recall, management, you know, long lines, so many other things that 100% negate the need to use an electric shock collar. There's just no need for it.
Amen. And then the one question I'll ask, if we can squeeze it in, is a lot of people, the other thing about the long waits is veterinary behaviorist appointments tend to be very expensive. Mm-hmm. And so that's, you know, something that not everybody can afford. It's the same with vet care. People, you know, sometimes hesitate when I say go to the vet, tell them about this, get some tests run, rule some things out, because that's also expensive. And I'm a big proponent of pet insurance for that reason, because I want you to be able to take your pet to the vet and get them care and get, you know, I don't want you to have to worry about that. Do you know, and maybe you can't even answer because different countries, different things, are there pet insurance that cover vet behavior services if you need it?
Yeah, so in the UK, absolutely. So Pet Plan, for example, which is a really big pet insurance company here in the UK, they do cover veterinary behavior I think there is a cap on it. I think it's up to £1,000 or it might be slightly more even. So there might be sort of a limit as to how much they cover, but it'll certainly get you the initial consultation and follow-up treatment. So it'll at least get you started down the right track. I have no idea how it is in the US. I can only speak for the UK because I'm familiar with this market. But yeah, absolutely, they do. And I think the more behavior starts getting recognized as a true area of veterinary medicine, this is an important part, mental and emotional health. I think the more that becomes mainstream, the more the pet insurances are going to jump on board and cover those things too.
Thank you, Dr. Jahn, for joining me today. My biggest takeaways from this conversation are to make sure you're starting any behavior modification journey with your vet. Give them as much data as you can and rule out any possible medical issue. Also, make sure any professional on your team is using positive reinforcement methods, as aversive techniques are not only completely unnecessary, but potentially damaging to your pet. And don't wait until this is the last resort to seek one out. The earlier you seek professional help, the better. Thank you for stopping by the dojo to learn with me this week. This is your aspiring sensei, Susan Light, signing off. You can find me at www.doggydojopodcast.com, or I'm Susan Light LA on Instagram, Pinterest, and Facebook. The music was written by Mac Light. You can find him at www.maclightsongwriter.com. If you like the show, you can support it by subscribing, sharing it with your friends, rating it, and reviewing it on Apple Podcasts. I'll be back in 2 weeks with another new episode of the Doggy Dojo.